Welcome back, everyone. It's Dr. Somji. I've got the most special guest here on the YouTube channel. It's my wife, Henal.
Hi, guys.
So, all of you that follow us on Instagram, Dr. Medi Spa account, my account, Dr. Somji Skin, as well as a lot of our patients that follow Henal on her Instagram account, they all want to know the same thing. What has she had done over the years? She's had unlimited access, that's one thing. Unlimited budget. We calculated everything in the till receipt, so to see how much she's had done. But the main thing is, and the reason why we're doing this video is that, hey, you can get things done, but if you have it done subtly, that's the key, right? So it's like a journey and a process over time. So we're just gonna talk honestly about everything that you've had done. What you think has worked really well, what you maybe think has not worked so well for you as well, because that's really important.
Of course,
Very rarely do people get like an honest opinion from doctors that offer all of these treatments, as well as yourself as well, because you used to do some of that treatments right, as well. So this is going to be really interesting. If you have any other questions about what Henal's had done or any more information that you require, just put it in the comments below. Also, we're going to do loads of videos like this as well, so click that bell button as well. But towards the end, we're going to go through Henal's top 3 treatments that she's had, all-time top 3 treatments. So stay tuned for that. The main thing that you've always talked about, and it's your eyes, right?
Yeah, it's always been my biggest concern ever since I was young. I mean, for as long as I can remember, if there were anything on my face that I could change, it would 100% be my eyes.
Yeah, so like, main thing is that you actually didn't have bags. You had a lot of hollowness around the eyes, and it made it look a lot darker. And I remember you saying that makeup can't cover hollowness, and that's exactly why people have this area treated. Yeah. So at that point in time, I looked at the skin and I thought, hey, you know what? The skin's a little bit thinner than other areas of the body, other areas of the face rather. And actually, probably we thought, let's go down the fat transfer route, because I don't want to have to treat you all the time.
Yeah, and also I think I was quite young when I had it done. I was a bit apprehensive to having other treatments done because I felt, I mean, it's a bit young to start having Botox and fillers and things like that when you don't really need it. So I really wanted to go down a natural route because that just made me feel better mentally. Yeah,
so I mean, you're talking about nearly, I would say about 10 years ago, or was it less than that?
No, it was about 7 years ago.
7 years ago.
Yeah.
So 7 years ago, so you're still like late 20s at that time period.
Yeah.
And what I said to you is that if you have that base layer of fat, then you can maintain it with tear trough fillers later on. So we injected fat transfer underneath the eye. So we got some fat from the hip, if I remember. Transplanted that fat, processed it to microfat, so little small droplets, and also nanofat and stem cells. And then we mixed that with PRP and injected it specifically in the eye in a very controlled fashion. So just underneath the eye in what we call the tear trough area. And that settled down really nicely, and actually it also helped with the skin texture, right?
Yeah, I mean, I think it made a very, very big improvement on the texture of my skin, because it wasn't just the crepiness under my skin or the fact that it was very thin, it was actually the colour underneath my eyes as well. And I feel that that made a drastic change to my appearance. And actually having this done really changed my life. It was something that would really get me down. It really knocked my confidence. I wouldn't want to have pictures. I used to hate looking in the mirror. I couldn't go out without makeup. I would have to wear concealer, and then if I wore concealer, I'd have to put foundation, and then I'd have to put everything else that goes on top, just because I wanted to cover my eyes.
So like, obviously fat transfer doesn't take completely. Probably about 50% of it kind of goes down very quickly, even within a year.
Yeah.
So, and instead of doing another fat transfer, we've always, just through ease, just topped up with tear trough, which a lot of my patients do. So, obviously there's a lot of videos online talking about like tear trough and why it's bad. Let me just clear that up, and we're going to do a separate video with one of the oculoplastic surgeons at the clinic talking about this. But if tear trough is done by a skilled person at the right time, in the right patient, in a measured way, it's a very good treatment. And that's what you've had. Like, I sometimes just put like a couple of drops in, and that's it. You don't have to put too much in. Yes, sometimes filler migrates, but if you put it in the right area, in the right patient, you should be fine. And if it does migrate, you can always correct that a little bit, but you've never had to do that.
No, I mean, since having my fat transfer, which was roughly 7 years ago, I've literally only had tear trough twice. And the last time I had it was about 2.5 years ago. So, and even then you didn't use the whole vial on me. No. You literally used like 0.5 of a ml.
Yeah, so like, you know, you've been complaining about your eyes again.
I have, yeah.
You've been asking me to fill, but there is actually nothing there for me to do right now, because specifically on the left side of your eye, it looks like you've got a little bit of prolapse of the fat, so the fat's coming a little bit forward, and that's, you know, you can't inject tear trough for that. This is when people make mistakes and it looks worse, and that's why some doctors that probably are not appreciating this sometimes say, oh, tear trough is bad. Well, tear trough is only good in certain patients, and it's been good for you for nearly 10 years.
Yeah.
And it's still good for you, but you're seeing small bits. I mean, your eyes are nowhere near exactly to what it was before.
No, of course not. I mean, but for me, I feel like I'm at 10 out of 10 with my eyes compared to how I was before.
Yeah. So other areas of things that you do a little bit of baby Botox, right?
Yeah, so I have baby Botox twice a year.
And what's that for? Like?
That's literally just a preventative treatment. I don't have any resting lines, but I have it done so that I don't get resting lines, and just to delay that aging process. I mean, we're all going to get old or look older at some point. However, I just have it done as a preventative just to delay that from happening.
I mean, look, my personal opinion is that you are, you know, the best looking person I've ever seen in my life. I don't think there's anyone that looks better than you. So I think that all of these
it's making me blush.
No, it's true. But I treat celebrities, I treat models, all these things, all these people on a daily basis. They come in and they see you and they're like, wow, like you actually look like what your Instagram looks like. Yeah. Because you don't use any filters, you don't edit anything.
I mean, I might put a random filter on if I'm having a crap day, but no, I don't actually like face tune my face or edit it. I might adjust the brightness or something like that, but I don't do anything drastic at all.
Yeah, I mean, that's pretty like important that you're saying that, because I think that people need to know that there's a reality of what people should look like. But yeah, I mean, I've done these treatments on you mainly like in a very measured way, and only when you ask me like 100 times.
Yeah, I literally have to force him to do something on me.
Yeah, because these things is, I would say to patients, is deciding what not to do is really important. It's very easy to decide what you want to do, but whether that's right, even in like 5, 10, 15 years, that's the difference, right?
Yeah, I mean, look, initially I would, like years back, I would say to him, like, can you do this, can you do this, can you do this? I'd literally want everything done, but actually, realizing over the years, I've actually realized that less is actually more.
Yeah, absolutely. And doing things that sometimes are a bit more sustainable. So like when we did a fat transfer, as you went through your like mid to late 20s, you started losing this fat pad that's sitting in here, the submalar area, and it kind of looked nice because your face was a little bit rounder first, and now it's a little bit more contoured.
Yeah, that's why I think people have asked me if I've had my fat pads removed.
So a lot of people ask you whether you've had your buccal fat pad removed, but you haven't. You know, you just tightened that area with some radio frequency and some ultrasound with the accent.
But I think I've just naturally lost some fat on my face.
And people naturally improve sometimes with age, especially if you're rounder. You look a little bit more. I say sometimes those type of people that age in that way, in their mid 30s, they look better than they looked in their mid 20s.
Yeah, and I have to say that I feel I look a lot better now than I did maybe 10 years ago.
And that's the art of like facial restoration, is to predict these things. So we'd like kind of define this beautification point, which is my Dr. Somji's beautification point, with some little bit of fat. And every now and again, we top it up with just one drop of filler just in that area, just to give you definition. Because I learned earlier on when I started injecting faces that it's got a lot to do with the way that, especially with females, the way that you put your makeup on.
Yeah.
And that's how I inject, is looking at light and shadow, where you're putting the contour to beautify a female, and the same thing to be said where you put contour to actually make someone more masculine as well. So it works the same way.
Yeah, I mean, Munir used to, when we first got together, this was like 12 years ago, he would literally sit there just staring at me when I was having my makeup, well, not having it done, when I was doing my makeup, and I realised that actually he did it every single time I was wearing makeup. And actually, I feel it's really helped you with your practice over time.
I mean, that's the concept of Contour Once when you look on our website. You know, Contour Once is about contouring and adding volume to specific areas, and then in some cases removing volume from different areas and tightening. And that way, in that nice holistic way, you're not actually just overfilling the face. You're doing like small touches, micro doses, to take baby steps to almost increase your beautification, which is what people want. People don't want to look like someone else. They want to look a better version of themselves.
Of course.
And that way, then you'll always look really natural. Look, we talked about like thinner skin around the eyes. You've had some like what we call energy-based devices around there. Which treatments have you had to help with skin texture?
So I've had the Clear Lift treatment, which is a laser treatment, and I've had it around my eyes. I've had a few sessions of it around my whole face because it just helps with like overall tightness, and also it helps with just overall rejuvenation. I've also had the Morpheus 8. Remember when you gave me a huge bruise on my face? I'd like to say that he actually did it purposely just to get back at me.
I mean, there's many vessels around the eyes, so if you've got to get the treatment done and you want it done properly, you've got to understand.
To be fair, I did say go aggressive around my eyes.
You lose.
Yeah.
This is why. Okay?
That's what you say.
Yeah, wow.
And I have had the eye pixel around my eyes too.
Yeah, so like, if we talk about lasers, we're floating this around, like Clear Lift is a Q-switch Nd:YAG laser, so there's no downtime. It works through photoacoustic waves, and it's great because you can get back to your normal activities really quickly. It's you can target different layers of the skin, so deep down in the skin up to superficially. So it also clears some pigment sometimes. So it's really good as a no downtime laser treatment for underneath the eyes. And then you talked about Morpheus 8, which is needle radiofrequency, which works deep down in the dermis, so the lowest layer of the skin, to generate collagen. You have to be really careful with the Morpheus, mainly because you don't want to go too deep as well. So this is the reason why we only did it at just at 1 millimeter. So then there's the most superficial skin. To act in the most superficial aspect of the skin is the erbium YAG laser, which is a fractionated laser called the eye pixel from Alma Lasers, which is fantastic because 2 or 3 days of downtime, right?
Yeah, literally. I mean, it depends how aggressive you have it. I mean, I've never had it really aggressive because I never have time for downtime, to be honest. I'm always up and about and I'm always on the go. However, actually, I don't actually mind looking like I've had something done because I'm quite open about it. I tell people about it. If people ask, it's fine. But I was okay after day 2 and I could actually start putting some makeup on just to cover those pixelation marks around the eyes.
Yeah, and that all generates collagen. Main thing is, it sounds like she has a lot of stuff, but we actually keep things a long gap in between because it takes a long time for collagen to build. And if you keep stimulating the face, you get kind of treatment fatigue, So the actual term is called inflammaging, where you create too much inflammation and no collagen is then laid down. It's a very simplistic way of looking at it, but we always have to control the length of time in between the treatments, right? So as we come down, obviously you've had drops of like lip filler just to enhance, that kind of help with the symmetry of the lip. I do it in my kind of micro cannula, which means that there's no chance of like spread above the lip. If you look at these unnatural lip fillers, this is pretty much natural. Your lips are pretty much the same as they were when you really didn't have filler, right? Yeah, I mean, you do a lot of skin boosters in my lips as well, just to keep them hydrated and keep those lines away. Yeah, so skin boosters are fantastic. Still made of hyaluronic acid, but super natural. Yeah. And you can inject them in the lips very safely, quite nicely. So it's a nice little trick that I do, and I use that a lot on celebrities when they don't want people to know that they've had lip filler, but they just want the hydration. The other thing is that we do laser, so we do fractionated CO2 on the lip, right? Yeah, so most recently I've had the hybrid laser, which is a CO2 laser, literally just to rejuvenate and plump the lip up. Yeah, and it's almost like a no downtime treatment. Yeah, I mean, it was amazing. Smooths the lip, maintains that nice little bit of roughness. It's not a replacement for lip filler, of course, but it's very subtle. If you naturally have quite plump lips and you just want them to look a bit more rejuvenated and plumper, then that is a great treatment to have, yeah.